Hello, everybody. I was just wanted to update everyone on my surgery, my back surgery. It was a microdiscectomy between the L5 and S1. I actually had the surgery in July 2012, which is a little over 6 years ago now. And I just want to update on what the process has been like and where I am now. And as of today, I'm fully recovered, have had no additional issues, um, and I'm actually stronger now than I was back then in 2012. It took me a while, but I slowly have been, doing the physical therapy stuff, continuing to lift weights and get stronger, and now I'm stronger than I was back then. So it was a slow process, and I think the two biggest kind of issues that I had were just my patience and just following the process and progressing incrementally as opposed to trying to rush to get back to where I was, which is exactly what I did, and had setbacks, had muscle spasms, and pulled muscles in my back, because after the surgery you really become incredibly weak, and it takes a while to get your strength back to where it was. So I would just urge people to be patient with it, and in your recovery kind of take it slow, be very consistent, don't skip on your physical therapy stuff or your workouts. You got to really focus on it and be dedicated to it. And the other thing that was a little concerning was the oxy when I had the surgery. It is incredibly powerful, and I was on it for 2 weeks, exactly like the doctor prescribed. And when I got off it, starting in week 3, I was sick for a whole week. I mean, that's how powerful that stuff is. So you got to be very, very careful with the painkillers they give you. And if possible, I would try not to use the oxy. I don't know if there's alternative painkillers out there. Maybe medical marijuana has advanced to a point now where you could use CBD drops or something like that. But be careful with that stuff. It is scary powerful. So as far as what I did to recover, a lot of chops and lifts in the gym. Also a lot of planks, just getting your core strong again and stable. My core was very weak and imbalanced. That's the other thing. And the imbalance is what I think really led to my disc herniation. So just following, doing a lot of the core work, the chops, the lifts, the planks, any stability related core work is very, very important. There's a lot of different things you can do with bands and that kind of stuff, and kettlebells, like the Turkish get-ups. They're excellent for kind of helping with any imbalances, and also really focusing on strengthening the core. The other exercise that was like part of my daily routine was single leg deadlifts. It's also very important for core stability. That works, the core very well. And then now I'm back to regular deadlifts, deadlifting more now than I ever have. Deadlifts are very important. People have this, I think, misconception that deadlifts are bad for your back. But if you do them correct, you do them with the right form, they're actually the best back exercise you could ever do. Just got to be careful and be smart about how you do it. And you don't have to go heavy. You don't have to go heavy at all. Any single arm movement, so like I was doing single arm chest presses on stability balls, on the stability ball, which really forces you to use your core. Any exercise that really forces you to use your core is very important to kind of gradually getting your strength back for your back and your core muscles. So single arm dumbbell presses overhead for shoulders, or any single arm movement, and then any movement in the rack position, like with a kettlebell, whether it's lunges or presses or anything like that. All very, very important to get your core strong again. Your core gets extremely weak after the back surgery, and so it's important to incrementally build your core back up, because you can't get stronger in the rest of your body unless your core is strong and stable. So those are some of the things that I've done to kind of get my strength back. Also did a lot of foam rolling and mobility work, and I know most guys don't like doing that stuff, and especially if you're younger, you really don't need to, because you're not at a point yet where it starts really impacting your workouts and recovery. But the foam rolling helped immensely with kind of my back, my hips, my core, and making sure that you're mobile as you kind of progress with your strength is also very important. So in hindsight, it was absolutely the best decision for me. I wish I was a little more patient as I was getting back into building my strength up. Probably took a full year before I was as strong as I was before the surgery. And then it took a while longer to actually not have setbacks, not have muscle spasms, not pull muscles because I went too heavy too quick. So patience is really key. But now, 6 years later, I feel great. I've no nerve pain at all. I have no muscle spasms at all. I'm much stronger now than I was back then, and I think the whole thing just made me smarter, focused way more on core and stability than I ever have, which I should have been doing the whole time, but was not. Also had focused a lot on mobility, which is important to not pull muscles and cause unnecessary stress on your disc. The last thing I'll say is I did get one of those inverter tables for decompression of the spine, and I don't use that enough, but I do use it. It actually does make a difference to help decompress your spine after you work out, and that might be something to try if you haven't done that. But for everybody who's kind of going through the pain and trying to make a decision on what the best thing to do is, I hope this is helpful. And just my own personal experience, for me, it was definitely the right decision to get the surgery, and I hope everybody gets well quick. Thanks.